Hi, my name is Andy Katcher. I'm the Communications Director at NOFAS, the National Organization on Fetal Alcohol Syndrome, and I'd like to welcome everyone to this edition of the NOFAS webinar series. And we have a great webinar for you on the role of the social worker in preventing, identifying, and treating fetal alcohol spectrum disorder, FASD. And this webinar is part of a CDC project. We're working with a variety of DSWs, discipline-specific work groups, this one focusing on social workers on the topic of FASD. And before we get started, I'd just like to remind everyone that is interested, there is one free contact hour that will be provided from the School of Social Work at the University of Missouri for people that attend the webinar live. And that is available if you want to contact NOFAS. For more information, you can go to our website, www.nofas.org, contact us, and we'll provide that one free contact hour, again, from the School of Social Work at the University of Missouri. The webinar will be recorded, and a video recording will be available on the NOFAS website within 24 hours, although people that just view the webinar recording are not eligible for that contact hour. But that webinar recording will be available on the website, and that will be available at nofas.org on the section under webinars, the same place that the registration link was. There'll be a link to view the recording of the webinar. Also, you'll see a window, chat window, where you can feel free to type in your question at any time. And after the conclusion of the presentation, we'll get to questions, and you definitely have the highest chance of your question being answered during this webinar the earlier you type in your question. So feel free to type that at any point. And the webinar is scheduled to go from 2 o'clock to 3 o'clock p.m. Eastern Time. And if there are additional questions, we may go over a little bit if people have time, because we're not there's not a hard cutoff at 3 o'clock, but that is when we're scheduled to conclude. So with that, I'm going to turn it over to NOFAS spokesperson and Vice President Kathy Mitchell for more of an introduction.
Good afternoon and welcome. We're just thrilled to have all of you with us today. And we know that this is going to be a remarkable hour learning about FASD, because we have two great co-facilitators that have a lot of experience in the field of fetal alcohol spectrum disorders. So today we have Dr. Tenkku Lepper, who is a great friend of ours. And we've had the pleasure of working with Dr. Lepper for years in prevention programs around FASD, fetal alcohol spectrum disorders. And actually, Dr. Lepper and David Deer, who I'll introduce in a moment, are both working with NOFAS in a collaborative project funded by the CDC to educate a variety of different groups on fetal alcohol spectrum disorders, and one of those groups are social workers. So this is kind of a kickoff on some of that work. Dr. Lepper is an associate research professor and director for research in both the School of Social Work and the Master in Public Health program at the University of Missouri. She is a PI and director for the National Mental and Reproductive Health FASD Practice Implementation Center, which I was just actually referring to. She's also a PI for an intervention treatment program for youth and young adults with fetal alcohol spectrum disorders. In addition, she chairs the NOFAS Affiliate Network, and she's the president of NOFAS Missouri. David Deer is a licensed social worker and, again, a longtime friend of NOFAS. He's been involved with training folks on FASD for many, many years. He is a staff member at the University of Arkansas for Medical Sciences Center for Excellence in Developmental Disabilities. And he's been there for over 15 years, serving as their assistant director for the past 3 years. David has also served as the training director for their LEND program for the past 10 years and has served as the social work coordinator for 13 years. So he has many years of experience in training and developing educational programs about a range of neurodevelopmental disabilities, including FASD. So with no further ado, I will mute myself and I am going to turn the webinar over to our two facilitators now. Enjoy the webinar.
Thank you, Kathy, and thank you, Andy, for inviting both David and I to present today on this webinar series at NOFAS. I'm going to step right into it here, and I will be talking about several of the components of this talk today, and then David will pick up later on. So, not really knowing who is going to be on the webinar today, I thought I would at least talk briefly about what fetal alcohol spectrum disorders are. You will also know more about the social worker role and how they might help women clients reduce or quit alcohol use and prevent them from having a child with an FASD. You'll also learn how a social worker can identify clients who you may suspect has an FASD. And we'll learn about some current evidence-based interventions to treat or improve the lives of those living with an FASD and their caregivers. So what is fetal alcohol syndrome? Fetal alcohol syndrome is a disorder resulting from maternal prenatal use of alcohol, resulting in abnormalities in the child covering 3 domains: growth, neurobehavioral abnormalities, and facial abnormalities. Historically, many terms have been used to describe individuals affected by maternal alcohol use during pregnancy. And fetal alcohol spectrum disorders is the umbrella term that is now used to describe the range of effects that can occur in an individual whose mother drank alcohol during pregnancy. What are fetal alcohol spectrum disorders? Primarily, there are these 3 areas: fetal alcohol syndrome, which is the most severe condition on the spectrum. The child presents with damage to the central nervous system from prenatal alcohol exposure, which includes the facial features such as a smooth philtrum. Alcohol-related neurodevelopmental disorder, ARND, the child presents with damage to the central nervous system but does not exhibit the facial features. And then alcohol-related birth defects, ARBD, the child presents with a variety of central nervous system issues that may affect any number of these parts of the body, again from prenatal alcohol exposure. I do want to say one thing about fetal alcohol syndrome, and that is not is it always the case that we will see the facial features, but certainly you will see a variety of conditions across the spectrum within this diagnosis. A new name for a new condition, a new diagnosis for this field came in May of 2013 with the new name, neurodevelopmental disorders with prenatal alcohol exposure. And this is now in the DSM-5 with the number 315.8, other specified neurodevelopmental disorder associated with prenatal alcohol exposure. So why was this needed? Well, there was no mental health code that adequately documented the cognitive and mental health impacts of prenatal alcohol exposure. People with FASD may not respond to treatments used with the existing codes that were available, and providers and families often struggled with obtaining reimbursement for habilitative care. All of a sudden, I'm not able to go through. Here we go. So the diagnosis of NDPAE requires meeting all 7 criteria, and these include the history of prenatal alcohol exposure, and those particulars are listed under this category. neurocognitive impairment as evidenced by one or more of the following listed here, impairment in self-regulation in one or more of the following listed here, impairment in mood, attention deficit, impairment in impulse control, then deficits in adaptive functioning skills as evidenced in two or more of the following, including at least communication deficit and social impairment. The onset of the disturbance needs to occur before 18 years of age. The disturbance or the condition causes clinically significant distress, and the condition is not better explained by other direct physiological effects associated with postnatal use of substance, and those other conditions are listed here for you. So again, just so that we understand what happens, the fetal alcohol spectrum disorder is a spectrum disorder, as we've said, because brain damage, which is the primary condition, is based on when the mother drank during fetal development. So what you have here is a fetal development chart that shows the typical development of the fetus and in what stage of that development development is occurring. And so each child will present with different challenges in occupational performance and cognitive abilities depending upon where the mom drank in the various stages of pregnancy. Typical brain damage in fetal alcohol spectrum disorders may be exhibited as in this slide here. Particular note is the corpus callosum, the function of which is communication, sensory and cognitive information between the two hemispheres of the brain, and prenatal alcohol exposure that affects that element of the brain, that part of the brain is in storing and retrieving information, problem solving, attention, and verbal memory. And the other area that is particularly affected excuse me, is the cerebellum, which is the part of the brain that looks at processes from other areas of the brain to coordinate motor and cognitive skills. So this would affect controlling movements and maintaining balance and fine motor skills. So what is the prevalence of FAS and FASD? Philip May and colleagues in 2009 produced an article that indicated that the prevalence of fetal alcohol spectrum disorders in younger school children may be as high as 2 to 5% in the U.S. And we have other studies that have been published over the years. Sampson looked at the combined rate of FAS and ARND, or all FASDs, were estimated at 9.1 per 1,000 live births in some Western European countries. And as well, May and Gossage in 2001 also looked at FAS and ARBD and ARND, in which this may affect as many as 10 per 1,000 live births or more, depending upon the specific diagnostic methods and criteria used. So it is a very prevalent condition, definitely across this country and across the world. Fetal alcohol spectrum disorders, if untreated and undiagnosed, can also then result in secondary conditions. And this is a study that was done by Ann Streiskruth and showing just the number of things that can occur as the young adult or young child gets older and encounters a number of these conditions. These conditions can be improved or prevented with appropriate treatments for children and adults with FASDs and their families. And so you will see that a number of things that can occur can include mental health problems, school problems, sexual problems, legal problems, alcohol and drug problems, and dependent living. In terms of just sort of legal problems, for example, it is estimated that somewhere around between 25 and 40%, maybe even 45% of individuals who are in our prison systems may in fact have had exposure to alcohol use while their mother was pregnant. So what are the challenges that you might see of caregivers who are trying to parent children with FASD? Two professors at the University of Manitoba conducted a study to identify the challenges of parenting a child with FASD. They placed ads in 2 province-wide family association newsletters and at an urban hospital clinic for parents of children who had received a diagnosis of any of the FASD spectrum disorders. They were asked this question: what are the challenges you face parenting a child with a fetal alcohol spectrum disorder? They did cluster analysis and concept mapping to construct the themes which you see here on the left under challenge. And then the statements that are shown opposite each challenge were those that had the most central value to the meaning of the stated challenge. In other words, that's the most often that the sorters group them together with one another. So under the challenge, and these were the ones that were listed, preventing setbacks, for example. The one that was the primary statement among many was giving constant reminders seemed to be a challenge for preventing setbacks. Or another one, keeping plans. Going away on a holiday was particularly challenging in terms of keeping plans. Lack of support, not knowing what resources I, as the caregiver, can access is a prominent theme, and so on here on this particular list. And then another one, in terms of identifying the kinds of things and issues that result of working with children and adults who have fetal alcohol syndrome or any of the spectrum of disorders. It came out by Ryan, Bonnet, and Gass in 2006. This was conducted through SAMHSA and their FASD Center of Excellence. They conducted a series of town hall meetings in 2002 and 2003 to determine national issues surrounding FASD, and they had more than 500 people participating across the country. They published their findings in 2004, where the participants were specifically asked for increased access to existing services such as special education, income support, housing, vocational rehabilitation, developmental disability services, all within the scope and practice of social work. So, stepping into social work. We have here the assessment circle. This is developed by Cynthia Bisman at Byrne Maurer College in the Graduate School of Social Work and Social Research. She states that this is a joint activity, and it's by both the social worker and the client, in which assessment requires their mutual understanding and agreement. And this is out of her social work assessment case theory construction textbook. She also cites Mary Richmond in that it's a social diagnosis in which there is an attempt to arrive at and as exact a definition as possible of the social situation and personality of a given client. The gathering of evidence or investigation begins the process, the critical examination and comparison of evidence follows, and last comes its interpretation and definition of the social difficulty. So we have an assessment given here as an ongoing process that is both dynamic and multi-dimensional. And we have the components here of the client, the related systems, and the worker, and this circle represents the interrelated nature of the systems which interact in the assessment process. And this is nowhere more clear in working with an individual with fetal alcohol syndrome and their caregivers. So David and I are going to talk about the social worker roles in terms of both micro levels and macro levels. And I will talk about the micro levels, and then David will pick up with the macro levels. So we are framing this in terms of prevention, identification, diagnosis, and management. And I'll talk about each of these. But in terms of prevention, we're looking really at education of women about pregnancy and drinking. We're looking at education of social work providers about fetal alcohol spectrum disorders. In identification, we're looking at observing and documenting behaviors and facial features, talking to the mom about her drinking history. Under diagnosis, we're talking about how we might refer the individual to a diagnostic team, to may even being a part of a diagnostic team. And finally, under management, we'll look at some social work interventions and look at the secondary conditions. So most social workers encounter a child with FASD to a referral from other social workers, other caseworkers, medical personnel, teachers, or parents. And common presenting issues may include mental health issues such as ADHD, depression, and anxiety, not attending school, not wanting to go to school, behavioral issues such as aggression, defiance, oppositional defiance, inattention, poor judgment, social issues where they're unable to get along with others, they lack the ability to have friendships or maintain friendships, and also developmental delays in which they are typically behind development for their chronological age. And then we also look at assessment, in which we have both biopsychosocial of family and child needs, screening for mental health and behavioral health issues, standardized assessment instruments, financial concerns, and of course assessing alcohol issues in the family. There are some specific assessments that have been used for those with fetal alcohol spectrum disorders, and they follow along certain categories. So for example, under executive functioning and cognition, there's been the Kaufman Assessment Battery for children that's been used. In looking at adaptive behaviors, we used the Vineland Adaptive Behavior Scale in the intervention study that I conducted, and also looking at some things such as the child behavior checklist or the social skills rating scale in terms of behavior health issues. Social worker would also look at collecting and reviewing collateral information, preschool records, educational records, and medical records. One of the things that we have also been working on, in particular with the new project that we're working on with CDC, is alcohol screening and brief intervention, referral, and treatment, known as SBIRT. This is a clinical preventive service. It involves a validated set of screening questions to help identify client drinking patterns. It includes a short conversation with the client who may be drinking too much. And for those who are drinking at high, risky levels, it would include a referral maybe for specialized treatment. And again, it's a brief intervention, takes only a few minutes, it's inexpensive, and may be reimbursable. And so for the work that we're doing with CDC in this national project, we will be developing and working with some online training modules that have been produced here at University of Missouri, located at adept.missouri.edu, which stands for Alcohol and Drug Education for Prevention and Treatment, and was funded by SAMHSA. And there will be part of the training that is a role play component of MI, or motivational interviewing, that was originally done in a clinical simulation center using face-to-face simulated encounters with the trainee and a standardized patient. And this is a screenshot of the web page for ADEPT. And you would sign in, and you can go into that and go through the training. But we would be adapting this specifically for the social worker in this new project. And then we're adding a piece. Previously, as I said, the role play component was done in a simulation center here at University of Missouri, but because this is a national center, we are hoping to conduct the MI, or the motivational interviewing component of screening and brief intervention, in a virtual world using avatars. So The idea here would be that you as the trainee would enter the virtual world, and we would have a standardized patient entering from their end at their computer, and you would both meet in virtual world space, and you would assume an avatar, and the role play would be conducted in this virtual world space. The idea behind the role play is to give the trainee practice and hearing themselves talk through the screening and brief intervention interaction with a standardized patient to give them some comfortability, some confidence in conducting this training. And this would be a type of training that we would ask or seek the social worker to learn in working with their clients as they help them to address their alcohol use in their screening and assessment process. Other traditional types of roles for the social worker would of course include counseling and psychotherapy at the family level, at the individual level, and also of course at the group level. At the family level, the child may appear to be able to function, but the brain damage makes this challenging, and it's not necessarily can't versus won't. It's not that they can't do it, but it's just, I'm sorry, I'm saying that backwards. It's not that they won't do it, it's that they can't do it. It's worded backwards here on the slide. And again, this would be some kind of education and support that would be provided as part of the education for the family. Another thing to note is that there's tremendous variation in presentation of the child depending upon, as I said earlier, when the brain was exposed to alcohol during fetal development. At the individual level, it is very helpful for the individual to understand their diagnosis. This can act actually almost as an intervention itself, and understanding that they may need to have some support systems in helping them to accommodate their brain disability. And a lot of times in the literature, and we certainly use this in our intervention study, we looked at accommodating and reframing and brainstorming with the individual and the family in day-to-day situations. And a lot of that material was taken from Diane Malbin, who's a MSW and has her website called facets.org. And what I pulled from for this talk today is some information that she has developed, in that there is some typical primary characteristics in children and adolescents and adults with fetal alcohol, and that include a very long list: memory problems, difficulty storing, retrieving information, inconsistent performance, and a long list of things. Talk the talk but don't necessarily walk the walk, deficits in math, abstract kinds of concepts. And then there are also some strengths that they have that may mask their cognitive challenges. They may be very verbal, bright in some areas, artistic, athletic, friendly, outgoing, affectionate, helpful, and generous. And one of the things to note is that there are these preventable secondary characteristics, and if in absence of identification, they may have they may be experiencing chronic frustration, and you might see these kinds of things and symptoms and issues as they come in for help with within the social worker environment. Just briefly, the Partners for Success intervention sort of tried to capitalize on the idea of providing support for both the family and the individual, so we used a combined approach in addressing maladaptive behaviors over a 6-month period. We had 42 individuals and their families who participated. It started in March of 2011 and completed in August of 2012. They received a biweekly therapy session with a trained LCSW therapist, and then the youth met with a BSW trained mentor. No real significantly difference between the two groups. For the youth, intervention parents did improve coping skills and decrease their self-controlling behaviors and increase their acceptance of responsibility scores. And I'll talk about that in another light in a couple more slides. FASD in the education system, there's a need for early intervention again, the IEP, individualized education plans or the 504 plans, and adaptation to the environment to meet the needs. There are a number of programs and evidence-based interventions that are out there that can help with some of these issues, and I'll talk about them in a moment. Particularly of interest and concern in a lot of the families is trouble with social and peer issues, and there are some programs that are out there now to help with this. I put in this slide, this is a training slide that we did under Mr. FASD, which stands for Midwest Regional Fetal Alcohol Syndrome Training Center, and this was done by Joy Dahl, who was an occupational therapist, but the relevance here is the strategies for school-based practice, and so these would be applicable for the social worker to employ also as they work with the family and the young adults. And this is the kind of thing that we would be creating that would be specific for social work practice and making this available online as well. But you can find this at mrfasdick.missouri.edu/services. Also, again, traditional social work practice as case management, and would incorporate many of these areas, medical, educational, mental health issues, and then adulthood, because this is a lifelong condition, and independent living is very challenging for these young folks, young adults. Financial stability is very challenging, employment, and help even with staying on the job. In the study that I did with the families and the young adults, I heard this from women, families all over the country, that their challenges as they got older was in keeping a job and managing money. So those would be issues. And then also you would, as a social worker, be involved in referral, and we will touch on this again a little more in depth as David talks about this, but I want to highlight some of the work here in terms of supporting therapies, particularly sensory integration. And this is again from Joy Dahl, and these are some of the areas that you might encounter in working with the young adult or the child who has fetal alcohol syndrome. And these again are some of the symptoms you would see and areas that they might need help with as you are working with those individuals. So I'm going to turn this now over to David Deere from the University of Arkansas, and he's going to talk about macro level work.
Thank you, Lee. Well, thus far we've been talking primarily about direct practice, which is what most social workers engage. But even those of you doing direct practice, you probably have some meso and macro activities that you do. And we're all trained as social workers to have skills to allow us to do that. And if we're trying to do what's in the best interest of the individual, often you may need to tap into some of these macro type activities, including things like developing resources, building networks, developing programs, and educating and advocating. And I will talk a little more about the subparts of each of those as I go through individual slides. In resource development, one of the major things that you probably will do as a direct practice social worker is, in addition to the work that you do, will be steering the individual and or their family to other resources, whether it's other supports or services, long-term services and supports, or in some cases it may be information to understand more about the condition or about other supports that are available. And we, as social workers, need to become knowledgeable about where to find reliable resources. Sometimes we will direct people directly to those materials and resources, or sometimes we may distribute them directly. And in some cases, you may want to take existing materials and adapt them for your local setting. You may not always have all the components of programs that are described elsewhere, and you may need to revise and edit those to fit your local situation. I want to talk about some of the options that you have for finding these resources so you don't just have to go off on a cold search. Now, I realize this webinar is sponsored by NOFAS, but not just because they are sponsoring it. They have an outstanding website. You can go to the link that's shown here and find a wealth of resources. You can also go to some other government sites, one that's Substance Abuse and Mental Health Services Administration, one that's operated by the Centers for Disease Control and Prevention, also the National Institute on Alcohol Abuse and Alcoholism. In addition to those government sites, I've listed one that I would encourage you to direct families to for their personal use, and that's the FAS Community Resource Center. And then there are professional organizations like the American Academy of Pediatricians and the American Congress of Obstetricians and Gynecologists, who also have a lot of information on their websites. Another skill that you may be called on to do, and this is something in which social workers excel. If we know how to do anything, it's to network. And network building is also often needed in serving people with FASD and their families. So in some cases, and the ideal thing to do would be to find an existing network that if you're going to become involved, you can engage with that existing network. Then you can add your skills and expertise and invite the colleagues that are part of your own personal network to also bring their resources to the larger network. If you don't find the desired network in your state or your community, you may be the person to start that sort of collaboration. And I would encourage you to look to programs whose purpose overlaps with concerns within the FASD community. And there are a number of those that exist in every state, and there are also some that are unique to your location. And I'll go over some options for those allies in network building. Again, I would start with NOFAS. Two of the pages that they have that the very first place I would start is looking to see if there's an affiliate chapter in your state or your area for NOFAS. And then the second link I have is for a resource directory. They have those by state. They list all the different programs that they have identified that are working in the area of FASD. I would also encourage you to look at University Centers for Excellence in Developmental Disabilities. The next link will take you to that website. There's one in every state, and many of them are working specifically in FASD, but they all are working in developmental disabilities and would have common interest with you. I would also look at your state DD programs, and the next link shows you how to find that state agency that's serving people with developmental disabilities. I would also look at the early intervention program and the program for 3 to 5-year-olds. There are those programs in every state as well. The next link that I have listed is for maternal and child health programs. And there will be one lead program in each state, and then there are also programs that are getting funding to do other activities, and those may all be found through the link that I have listed by Title V. Also, on the adult end, I would look at Adult Protective Services. Each state has one. They would have a lot of overlap with your interest in FASD. Then there are national organizations that are serving people with disabilities, such as the ARC, March of Dimes, and Easter Seals. And I've listed their links to find the local chapters or the state chapters for your area. NAMI is also another national association that I would encourage you to look at. And then finally, I would look at the specific developmental disability provider organizations that are doing service delivery in your state, and there's a link to that group as well. Sometimes you may need to go even further and to develop programs. And again, this is an area in which you have training from your days in school, and many of you have implemented these throughout your career. And I'm just going over some of the basic principles that you would use in doing that, beginning with asset mapping to understand the strengths and challenges, and then build on those strengths to expand services or to address areas of need. And as I was just talking about, looking at the existing networks to enhance the services, and then consider possible funding options and pursue funding for those, whether it's donations or contributions of various sorts, or pursuing grant opportunities. And then recruiting the leadership that's needed to carry out that plan. The other area that we'll look at under macro practice is that of education and advocacy. And depending on your role in your relationships, you may be called on to educate clinicians, or it may be to educate policymakers. One thing I want to encourage you to remember as you think about advocacy and policymakers, sometimes the policies of agencies may be as important to the people you're serving as are the laws. A lot of times we look at laws and legal codes, but don't forget the agencies and their policies as well. And again, there are a number of allies you can turn to in this work, and that includes the Disability Rights Network. Again, there's one in every state. The Legal Services Corporation, whose attorneys serve low-income individuals. And every state also has a parent training and information center, or they may have more than one. And there's also a family-to-family health information center that I would encourage you to link up with in these activities.
Great. Thank you, David. So those are great resources that David has put together for us. And these next two slides are, I just wanted to say up in front that they're a little dense because I'm sort of focusing on what interventions are available that we are aware of at this time. Some of them are evidence-based interventions as well. And if I lose any of you at this point, you can find all of this information at the CDC website. This is all out of the Fetal Alcohol Spectrum Disorders Competency-Based Curriculum Development Guide. And a number of us have just finished updating this guide, and should be made available soon on the CDC FASD website. So there are a number of interventions, and we'll start with sort of some early intervention services. Research supports that early intervention services can improve child development. Services can include therapy to help the child from birth to 36 months talk, walk, and interact with others. The IDEA also provides some services and ways to help the family and the young child and adult. Speech therapy, language delays often do not necessarily require a formal diagnosis and may be incorporated as needed for the young child. There are also some protective factors to know, and that one of them is, as I mentioned earlier, early diagnosis, which allows the child to be placed in the appropriate educational setting and also receive the social services they may need. Children with FASD have a wide range of behaviors and challenges that may need to be addressed, and what's noted is families who receive counseling or respite care have a more positive experience than those who don't. Children with FASD can be and often are more sensitive, as I've mentioned a little bit earlier, to disruptions, changes in routines, also harmful relationships, and so having a loving and nurturing and stable home environment is considered a protective factor. and of course as well the absence of violence. In the Partners for Success intervention study that we conducted, one of the things that we noted was that there was a big difference in open versus closed family systems. So if we worked with a family system that was very open to learning new things about fetal alcohol syndrome, learning new things about parenting, and working with their young adult with fetal alcohol syndrome, they did very well in the intervention and got quite a bit out of it, as opposed to maybe a closed system where they were not necessarily able to, they just didn't want to hear from somebody else how this child is not being willful. They just have some challenges, and so they just really weren't interested in learning new parenting approaches. And then I'm going to go into a little bit more detail on types of treatments. There's medical care treatment that would be specific to the kinds of conditions that the child with fetal alcohol syndrome might have. There are medications that are available not to treat FASD, that is not treatable, but to manage some of the symptoms. So there are stimulants that are used to treat symptoms such as hyperactivity, problems paying attention, and poor impulse control. There are antidepressants that are used to treat things like sad mood, loss of interest, sleep problems, school disruptions, negativity, irritability, aggression, antisocial behaviors. There are neuroleptics that are used to treat symptoms of aggression and anxiety, and of course anti-anxiety drugs. Under behavior and education therapy, there have been a number of evidence-based interventions that have been conducted. Friendship training by Mary O'Connor and her colleagues that works on the fact that some of these children have a hard time making friends, keeping friends, and socializing with others. So the friendship training teaches the children with FASDs how to interact with friends, how to enter a group of children already playing, how to arrange and handle in-home play dates, and how to avoid work and work out conflicts. There's some specialized math tutoring that was designed by Claire Coles. If you go to do2learn.com, you'll see just a wealth of resources available there, basically giving some special teaching methods and tools that can help the child improve math knowledge and skills. Executive functioning training by Ira Chasnoff and his team is available at the alertprogram.com. This teaches behavioral awareness and self-control and improves executive functioning skills such as memory, cause and effect, reasoning, planning, and problem solving. And then also the Parent-Child Interaction Therapy by Heather Carmichael Olson in her Families Moving Forward program. This is a type of therapy that aims to improve parent-child relationships, creates a positive discipline program, and reduces behavior problems in children with fetal alcohol spectrum disorders. And we based the study that I did on older children and older youth on some of Heather Carmichael Olson's work. I misspelled her name. There's no D there, O-L-S-O-N. And then finally, there is also some parenting and behavior management training. So that's a typical kinds of things that a social worker may be familiar with and employ in working with the family. And then there also are some alternative approaches that have been used, a number of them: biofeedback, auditory training, relaxation therapy, yoga, acupuncture, massage, and some very exciting work that's been done with animal-assisted therapy. And also there's some work done in Tennessee, as a matter of fact, with equine training and those who have fetal alcohol syndrome. And David's going to pick up here.
Okay, I'm going to talk about discharge and transition planning. And what I'm going to talk about here is not really unique to people with FASDs, but I think that the need to follow this may be heightened for this group because of particular challenges that they have. And you want to remember that what we're talking about is a process. It's not a one-time meeting or one-time event. But it's an ongoing process between the family and the professionals. It should be individualized and should begin early. You start from the beginning planning for discharge or transition. You need to honor the patient and family's goals and preferences. That's a basic tenet of social work anyway, but we really need to remember it as we're working here. We need to identify and answer the patient and family questions and concerns using simple and concrete language, and to identify resources that are in place and those that are needed for transition, and particularly paying close attention to supports that are needed. And that's one thing that sets this group apart. They are probably going to need more supports for longer throughout their life than their typically developing peers. And incorporating that into your discharge and transition planning will be essential for being successful. Lee, back to you.
Thanks, David. So in conclusion, FASD impacts the occupation significantly and is important for social workers to have a comprehensive understanding of fetal alcohol spectrum disorders. In addition, the field of social work is ideally situated to be a significant provider and support system for the child, adult with FASD, and their caregivers. Now, we had sort of put together a case study which you can walk through on your own. This is Sean, who's 9 years old. His mother drank to excess several times a week. Normal delivery, full term, but small for gestational age, and the child is adopted at birth, which is a very typical scenario. The developmental history, small for age, difficulties in school, poor social skills, diagnosed with ADHD and low IQ, and the parents report these following conditions. So you as a social worker might think about what assessment interventions and support and referrals might be helpful to this family. We have a couple of sets of questions here for those who are looking for contact hours for this particular webinar. And here are a set of references. So this concludes our webinar today, and now we will turn it back over to Andy in terms of answering questions if there are any.
Hi. This is Andy Catcher again here at NOFAS, National Organization on Fetal Alcohol Syndrome. Thanks very much, Lee and David, for that great presentation. And we have a few questions that have come in that people have typed in, and feel free to type in your question at this point as well if you'd like an answer. So I'll just get to one of the questions that we received was asking about, this person is in Canada, working with adolescents living with FASD, noticing a shortage of resources and facilities, diagnostic resources and such. And the question is, do you think the establishment of a regular, consistent respite relief program would be beneficial for families of adolescents living with FASD?
Absolutely. There's a respite locator that is here in the U.S. I don't know. I haven't gotten into it to know if it goes beyond just the United States or if it covers more than that. And then it seems like there might be some additional resources for that kind of information available in Canada. Trying to think who is the organization that we work with, FASWorld, FASWORLD. .com, I think, or it might be .org, and that's Brian Philcox and Bonnie. I'm forgetting Bonnie's last name right now, who have got a wealth of information and a lot of support services for parents in Canada.
All right, great, thank you. One person had asked, I don't know if you had mentioned Cornelia de Lange syndrome. They were asking what that is.
Good question. That's on one of these slides. So I'll have to look that up and give you the specifics and get back to you on that, because I'm afraid I can't give that exact explanation of what that. There are a number of things that are out there that have some of the similar attributes and display similar symptoms as fetal alcohol syndrome, but are in fact not related to prenatal alcohol exposure, and that's one of them.
There are a number of genetic syndromes that sort of appear very much like FAS, as Lee was saying. The best bet would be to go to a genetics program or a dysmorphologist to parse out those differences, but some of them have very similar facial features and maybe some of the same behavioral and cognitive challenges. And Cornelia de Lange is one of those.
So I just looked it up online real quick. Oh, it says I'm no longer the printer. Am I still on? I guess so. And it says that it's characterized by slow growth before and after birth, intellectual disability that's usually severe to profound, skeletal abnormalities involving the arms and hands, and distinctive facial features. So again, those would be very similar to the kinds of things you might see with fetal alcohol syndrome, but this is not due to alcohol exposure.
All right, thank you. Let's see, looking at some of the additional questions. And one person is asking, how do you differentiate a child with FASD with a child that has early trauma?
Early trauma.
That's the question we always get. We've had some projects here in Arkansas where we've worked closely with our child protective services and the courts, and it's a lot of times the child has had both. They've experienced trauma and as well as alcohol exposure, and it's hard to tease out some of particularly the behaviors that result from the two of those. What I would say is finding someone with experience and training on FAS. They then can more readily tease out the difference. The real problem lies with the people on the spectrum that don't have the facial features that we're talking about. That would be one thing that would set aside someone with FAS from someone who's experienced trauma.
Great, thank you.
Okay, we had a similar question. Somebody wanted to know if autism was a frequent misdiagnosis or a diagnosis that is seen with FASD.
So the one condition that is often misdiagnosed is ADHD, and some of the symptoms, again, of ADHD, such as hyperactivity, are also seen in children with fetal alcohol spectrum disorders. And there are some similar kinds of characteristics between autism spectrum disorders and fetal alcohol syndrome. I'm not as familiar with the rate of misdiagnosis for autism. David, are you?
Well, of course, autism has become the diagnosis du jour, you might say. It I think has replaced ADHD as being the thing that everyone thinks of when they see a child with odd mannerisms or behaviors. For someone with experience working in developmental disabilities, it's pretty easy to separate the two. Although I agree with Lee, there are a number of traits and characteristics that the two conditions often have in common. But again, as you become more familiar with the two conditions, it's really not that difficult to separate the two. But you also have to keep in mind that one individual may have both. They could have autism and an FASD. It's not real common, but there's nothing to prevent that. One of the people I work with in the autism field, when I started talking about some of the similarities, her comment was, well, what do you expect? They're both brain-based disorders.
Great, thank you. And we have a question about a person asking for materials that might be appropriate to share to somebody to educate them about a new diagnosis of FASD. For example, this person says that they have a therapy client who just met with that they suspect of having FASD, that just met their birth mother for the first time. That confirmed that drank throughout the pregnancy. This person's 19 years old, and client doesn't have any information really about FASD, so they're asking for resources that they, in the question they said they intend to share some of the NOFAS videos that are on YouTube, and asking if there are other materials. So I'll just add, on the NOFAS YouTube channel, there are many video interviews of people living with FASD that I think a lot of people would find helpful. Also interviews with birth mothers themselves sharing their stories, and also doctors and researchers kind of talking about information and science of FASD, as well as personal stories. Particularly of note, I would highlight is that Morgan Fawcett is a young man living with FASD that shares his story. There's a video interview with him on the NOFAS website that a lot of people have found really engaging and powerful and educational. And also there's a DVD called 8 Magic Keys, which has tips and strategies for people with FASD. The DVD of that is for sale on the NOFAS website. If you go to nofas.org, and there's a page to order NOFAS materials. So also turn it over to Lee and David if you have more information on that.
Those are all excellent resources, and I think in terms of trying to get the information across quickly, I think the YouTube videos are excellent. And then from there are, as Andy's already suggested, a number of resources available at the NOFAS website, and you can start there. David, anything else you want to add?
The only other thing I want to mention, I realize the question is about working with someone with the diagnosis, but you also mentioned a birth mother, and Kathy Mitchell, who introduced us at the beginning, coordinates a support group for birth mothers, Circle of Hope, and I would encourage people that are looking for support for birth mothers to turn there.
Great, thank you, David. And this is Kathy again. Thank you so much for reminding me to let people know you can go to our website to learn more about the Circle of Hope, or you can email me at mitchell@nofas.org. And I believe we're going to wrap up the webinar at this point. And thank you so very much. That was just fantastic, and I'm sure more great webinars to come for social workers. And Andy, I know you have an announcement.
Yeah, and I just remind people that there's that one contact hour available through the School of Social Work. You can email, you can contact NOFAS for more information about that. Just go to the NOFAS website, www.nofas.org. A lot of people have been asking about getting slides of the PowerPoint slides of the presentation to print out or to share with others. So a video recording of this webinar has been recorded, and a video recording of the whole webinar with the presentation, the slides, and Lee and David speaking will be posted on the website within 24 hours. You go to nofas.org, and there's a button called Webinars. It'll have that. Also, the slides will be made available, so I believe a PDF or some similar format for the slides will be posted on the website in a format that people can share and print if they'd like. So that'll all be available at www.nofas.org. Navigate down to a button, Webinars, or the navigation bar. There's a button on the home page, and you can find all that information. And also, I'd just like to remind everyone that NOFAS has a very active social media profiles, social media pages where you can get a lot of updates and information about FASD. You can go to our NOFAS Facebook page, and also NOFAS on Twitter. And you can go to our website, nofas.org, and sign up for our email list. It's once a week, every Monday, email a newsletter called the Weekly Roundup that has a list of the latest stories in the FASD field, stories about people living with FASD, the latest research, stories from various news media about alcohol and pregnancy and FASD, personal stories, interviews with people, that sort of thing. All that's available by going to our website, nofas.org.
And you can contact us if you have an event going on in your community that you'd like us to promote for you as well. Thank you so much, and have a wonderful afternoon, all.
Thank you.